love to talk a little bit about the Portland Street response, if that's okay.
Yeah.
Also, for folks listening and watching, we're still in this 2020. It's a very transformative year. So in 2020, Portland voters voted overwhelmingly to institute the Portland Street response, which is an alternative to emergency response call for vulnerable Portlanders experiencing crisis. Despite the Portland Street response's popularity and the expectation that the program would evolve to be 24 hours, 7 days a week, the budget has been under attack for 2 years, and resulting in slashed budgets and also just really slowing the implementation. I would also add that many of the folks have been asked to do things that's been outside of what the initial vision was, in terms of the staff members who are working in it. I'm curious to you, what do you see Portland Street Response within the context of public safety, and what are your plans to ensure the future of Portland Street Response and its services?
Yeah, I love this question. I love Portland Street Response. I see Portland Street Response as the core of our public safety response system in the future. It's not going to get there tomorrow, but that's the long-term vision. I'm the only candidate for city council in any district that's worked directly with Portland Street Response to try to address some of those funding issues. I've written grants for them. I've worked on their strategic planning side of things as well. And I'm deeply committed to it and its success. And in the very long term, I hope that it's it's the default responder, unless there's a reason to dispatch another responder, because they do a really good job. I've seen them at downtown Pioneer Square. I've seen them at Overlook Park, doing good work with folks in behavioral health or mental health crises. And that's a really important thing. It's that overlaps with the houseless population quite a bit, but it's not exclusive to that. So it needs to be 24/7. It needs to be citywide. It needs to be dispatched through 911, and it needs to have those policies that restrict what it can do be adjusted over time. Policies like that are a couple examples. If a person's having a mental health crisis in a sidewalk, Portland Street Response can respond. But if they go into a business, even if it's a public-facing business during its hours of operation, they can't. If they go into the roadway, then they're not supposed to respond there as well. If a person says that they're suicidal, then they're not allowed to be the primary responder. And if they have a sharp stick or a small knife as well. And these are mental health professionals who are trained in that particular type of work. They are generally the ideal responder for that. And this isn't just my vision, it's shared by a lot of the folks. That's why I have all the endorsements related to it, from the laborers at Protect 17, to the founding commissioner, Joanne Hardesty, to the Friends of Portland Street Response, its primary advocacy group outside. And so those are things that I care about a lot. In terms of plans going forward, I'll mention 5 things if that's okay. One, we have to, and these are sort of shortest term to longest term. First, we have to ensure that the move continues to be good. That from Portland Street Response has moved from fire into, it was the community safety division that day, but now the public safety service area. Make sure that they're welcome. Make sure they know how popular their program is. Going out and about in the community, it's about as popular as turning the faucet handle and having water come out. Or going to a park. Those are really popular programs, and I think Portland Street Response is just as popular. It needs to be staffed and budgeted appropriately. At first, that will be city dollars, because it is more complicated than it might appear to get Medicaid funding, which I know is a conversation. I don't say it's complicated to say we can't do it. I'm working on it personally. I'm just starting to learn about its complexity. It's just saying, we'll need to start with some city funding, and then eventually over time, which is the third thing, pursue partnerships and Medicaid dollars so that we can take the city funding and replace it with like Medicaid match dollars and things like that. Policy to remove those restrictions that I mentioned earlier is another big part of it. And finally, elevation in the org chart. So that means things like eventually what Seattle did, where eventually it can be its own bureau. So those are the things that I would like to pursue. I will say I'm really excited talking to candidates around the city, both within this district and elsewhere, that Portland Street Response is very popular among the candidates too. So I am always cautiously optimistic, but I'm cautiously very optimistic about the future city council working to support this program. And I'm happy to be one of many, hopefully, city council members in 2025 who works to support Portland Street Response.
Thank you so much. I will say personally very excited about this vision of it being its own bureau one day. We've heard that quite a bit as we've been doing these conversations, so thank you. There's so much to discuss.